This is welcome to DOCTALKS, Foot Care for Health and Wellness. You can go to the next slide, Manny, that's fine. Really pleased to have you here. My name is Jeff Malmgren. I work with the Burnaby Primary Care Networks, and this is a presentation of the Burnaby Primary Care Networks. As you'll see on the screen, there is translation available for this session. You just look at that giant yellow arrow and then push the button right down below it, and that will get you to Mandarin translation. We're lucky. We've got translators from Mosaic, from Yvonne and Alex, who will join us, who are translating for us today, which is just great. Always good to do that. Just before we start, I do want to remind you that this session is being recorded, and what that means is it will be available for you to be able to see afterwards, and also to share with your family and your friends. It will be up on the burnabypcn.ca website, as are all the DocTalk presentations. There's quite a few of them up there now, and they cover topics. Well, some of them around COVID, but often particularly around seniors' health and around other health issues that we all face in the community. So it's a great resource. Again, it's burnabypcn.ca. We will try to provide time at the end of this presentation for it to answer some questions. If you can please, rather than raise your hand, put your questions in the Q&A. If you put them in the chat, we might find them, but it might take us longer. If you put them in the Q&A, we get them right away. So without further ado, I want to introduce Evelyn Cox. And Evelyn's a foot care nurse serving Burnaby and Vancouver. During the pandemic, foot care services that were previously offered with Burnaby Senior Society had been suspended, and Evelyn has been providing services through the Edmonds Urgent Primary Care Center and recently at Burnaby Neighborhood House North location, and with the support of both the primary care networks and the Division of Family Practice. And this has been an incredibly valuable service. It was so great that Evelyn was able to continue to provide it. It's been greatly appreciated across the community. So without further ado, I'm going to turn it over to Evelyn. Welcome.
Okay, thank you, Jeff. And my name is Evelyn Coxon, and I am a registered nurse. I'm also certified foot care nurse. I belong to Fraser Valley Foot Care Nurses Association, so we meet, or we just started meeting actually. We usually talk about the standard of nursing practice in British Columbia, and the tools and how we sterilize our tools. So before pandemic, I used to do all the foot care at the senior center, which is Edmonds, Bonser, Confederation, and Cameron. But because of pandemic, the senior society was closed. So then I also go to the nursing home, but because I'm an essential practitioner, so I go to Burnaby in nursing home, and sometimes I get house calls, and also in Vancouver. And then recently, is it almost like I think a year or more than a year, we started to have the clinic at the Prime Care Medical Clinic, and also the about maybe 4 months ago, or less than 6 months, I guess. We started at Burnaby neighborhood on the north side of Burnaby. So today I would like to discuss some of the common problems. I will just, there's a lot up there, but I'm only gonna concentrate on 5 foot problems. And can you get the next slide, Andrea? Yeah. Here we go. A step in the right direction. Next one, please. Okay, let's just touch a little bit of anatomy of the foot. There are 26 bones and 33 joints in each foot. So if we have any problem on this, you know, it will be hard to walk. And so it's so important to look after our feet. This is the least part of our body that we look after. We look after our hair, our nails, our fingernails, but you know, the feet is so important. My experience is I had bunionectomy about 20 years ago. So until now, I still have pain. So with older adults, that's a lot of problem what's going on. So let's go in the next slide, please. There you go. And then I will talk about 5 common feet problems. Next one. The first one is, next slide. Okay, you see the dry skin? It's so common with older adults. In my practice, I see a lot of this dry skin, and the medical term. Can you just turn the next slide? Next slide. Yeah, I said. And dry skin the causes of dry skin, which is the medical term, is cirrhosis. Using sensitizing or hard soap, bathing for too long or too often, direct contact with chemical agents, environmental factors such as air pollutants, cold and dry air. Next slide. So what treatment can be done? So reversing the effect of dryness is done by stopping exposure to the cause of cirrhosis. Adding creams to the skin prevent evaporation of the water from the pores of the skin and increase elasticity of the tissues. Apply after bathing and, if necessary, repeat 2 to 3 times a day. Next slide. The second one is calluses. As you see on this picture, there's like pressure on the heels and the plantar side of the foot. And what causes calluses? Next slide. Next one. That's a different topic. Okay, calluses and corn. Definition: a callus or a corn is a buildup of skin that forms at the points of pressure or bony prominences. Calluses from on the bottom side of the foot. Corns form on the top of the foot and between the toes. It causes repeated friction and pressure, skin rubbing against the bony area or against an irregularity in the shoe, as well as hereditary disorders. What treatment can be done? Performing trimming and filing, place padding for protection, and get fitting shoes. So with me coming in, like the Prime Care Medical Clinic, I have a special machine that files and buffs the nails. And it's really worked because this machine, it has a vacuum system. So it's 99.9% that it's not on the air. It's it has a vacuum system. So I debride I debride calluses and corn. I don't actually lift them up, just keep filing them. Next slide. Okay, so the first picture, you see the calluses and they're like on top of the toes, and then and they're really painful. As you see, it's really like this. The first picture is the feet are so tight to each other, and then if you wear a tight shoes, that causes this is what you call seed corn. And the second picture after the treatment, that's what you see. So it's a big difference when after they're buff and filed. Next one. And the next topic is fungal nails. Very common for the older adult if they don't look after their nails. So causes of nail fungus. Next slide. Okay, fungal nails definition. Nails fungus is a chronic condition with implication for patients that get beyond the nail. Patient with a fungal nails condition may present discoloration, nail thickening, scaling, and detachment of the nail plate from the nail bed. and it caused by the yeast called Candida. So when I see this patient with these thick nails, which is so common if they don't look after their nails, I debride the nails. There's a lot of medication in the market, but with the older adult, it's quite hard on their liver. So if you do the regular treatment for nail fungals, like I do recommend to start every 4 to 5 weeks to come and see me. So just keep on debriding and cleaning, and of course just put a lot of lotion, and sometimes I do put like organic oil. But there's actually a treatment. If they're really bad, I ask them to see their family doctor to get some medication. Next slide. Okay, there is an increased risk of the fungal nails infection for those with certain condition or health issue, such as I see a lot of diabetic patient who's got a lot of their nails are fungal nails. Also psoriasis, a weakened immune system, and being in poor general health. Next slide. What treatment can be done? Talk to your family doctor about antifungal medication, and also regular foot care treatment. And after washing your feet, try to dry your feet, especially in between the toes. Also, the socks need to be changed daily. Next slide. Okay, this is really like a typical nail fungus that I've seen on the left slide. So after the treatment, this is what you see, like just debriding the white discoloration of the toenails, which sometimes you can see that they will come off, because the first picture, the nails hasn't been really cut, and as you see the discoloration on the foot, it's not great. So the nails are not really getting proper blood circulation. So we really don't know the cause of nail fungus. But if it's really bad and it's giving like an infection, I do recommend to see their family doctor to get some prescription. And this is before and after the treatment. Next slide. Okay, the next one, the last, I think this is the last one, is the bunion. I had bunionectomy probably 15 years ago, and bunions are really painful. And as you see the picture here, next slide. The definition is a bunion is an enlargement of the base of the big toe caused by misalignment of the joint, may be swollen, tender, painful with wearing of footwear. And the causes are genetic, biochemical abnormalities, neuromuscular disorders, inflammatory joint disease like arthritis, trauma, congenital deformities. So I had this experience, a bunionectomy. I was on crutches for 3 months, and also it took a year to get my left foot was discolored, and it was so painful. So proper shoes is very important when you have a bunion. You need a wide shoes so then they're not gonna get hurt. What treatment can be done? As I said, bunionectomy, but with older adult, it is very painful because you have to be non-weight bearing on your whatever the foot, because they don't do both, because you'll be totally handicapped if you do both bunionectomy. So wear comfortable shoes and well-formed fitting shoes. Wrong shoes can be a problem, of course. And what I said, if you have a bunion, it's recommended to wear a wide shoes. Okay, So these are the 7 tips to maintain healthy feet. Number 1, inspect your feet regularly. Number 2, maintain good foot hygiene. Number 3, hydrate the skin. Number 4, buy proper size shoes. And number 5, change socks daily. Number 6, cut toenails straight across. And number 7, exercises. And that will be like you have to keep active. So the circulation on your feet, it's important. And that's it.
Thanks, Evelyn. That was
Any
wonderful.
question? Just yeah.
Yeah, I think I have there's some questions coming. I have a couple of questions. So, you talked about, the seven habits. What are the things of those things, those 7 things that people should do? Is there any one or two that people just don't do, and that's what gets them into trouble the quickest?
Well, the wrong shoes is so important. Like a lot of the older adults, they don't wear. Apparently, technically, you have to change your shoes every year, but we wear the same shoes every time. And that depends on your mobility too, right? If you're active and running and doing a lot of exercises, you need to go to the, I have, like if my clients they have bunions, of course, you need a wide shoe. So I do have some stores that I ask them to go. One is Foot Solutions. So they can actually go to those stores and get well-fitted shoes, what's recommended for my clients. And of course, did I answer your question?
Yeah, I think so. I mean, I guess. And what about heels? Is wearing more heels? Does that lead us to more foot issues, or is that just a different? Does that have any impact at all?
The heels. If you have a proper shoes, that should not be a problem. But that proper shoes, like the size of your feet, it is important. Plus, also, like if you're wearing socks. So I do recommend 90% or 95%. You don't see much of these socks anymore, like 95% or 90% of cotton. But if they can find a higher cotton on the socks, it absorbs better. Like if your feet are sweaty.
Right. Okay. So good socks is just as important as good shoes.
And you gotta change your socks every day.
Yeah, because they're not any good if you've worn them for a day or two.
You got fresh socks every day.
Well, and I notice now you can even buy, these very specialized socks that have padding in them, and they are left and right socks and all of those things. But I guess they're for what maybe are they for people who maybe already have foot issues, or for specialty feet issues?
Yeah, well, if you're diabetic, you need a special like a compression socks, and of course the cotton, right? In my praxis, I just recommend like a white socks and good cotton socks.
Good cotton, yeah. There is another question along these same lines. Are there are there specific exercises that you can do to keep your feet healthy?
Yeah, well, just trying to massage your feet when you're watching TV, and then if you go like Foot Solution, they have all those one when you buy their shoes, and then they just tell you like, oh, just raise your heels, like go on the wall and try to raise your heels. Those are the good exercises that they do recommend.
Yeah, heel lifts. Yeah, and those are good for your calves too, I think.
Absolutely.
So, yeah, and I've done that one. There's a question about, and this is the one that I don't know anything about Taylor's bunions. Is Taylor's bunions a specific sort of an issue that you see, and is it different from regular bunions in terms of how you deal with it?
Okay, bunions is so genetic. I haven't really heard about Taylor's bunion, but the bunions that what I said, like if you're young, I think it is advisable to get your bunion done. But recovery is so, I was young when I had it done, but it still took me a long time. Like you have to be non-weight bearing on the foot that was done, like bunionectomy. And I told my orthopedic surgeon I don't want it to come back, but then they fuse it, and it's still like when they put a two screw on top of the on my foot, it was rubbing when I got my shoe on, because it's not swollen anymore. So they have to put me back again to operating room to remove the the fuse that they did there. They put a screw. So
Wow.
a bunion, for it's important to have a wide and well fitted shoes, and also like you need to massage your feet. If you I can't walk too far because it will just putting a lot of stress on my feet. So if you have a bunion, just try to I do recommend just massage your feet at nighttime, and yeah, and do those exercises, because it's
Great.
a deformed,
It's a deformed. Yeah, I got it. It's a
your feet are not
deformed.
really in a normal position. They're kind of
Yeah.
deviating in that one side. Yeah. Did I
So
answer
this is,
that question?
I think you did, yeah. And this is an interesting one. This is a 79-year-old person who has healthy feet, but I don't know, have been wearing extra socks, more than one pair at a time, to keep warm. And they've noticed that the big toe and second toe seem to feel cramped. There seems to be swelling and even redness, not necessarily pain. The toes just feel tight and swollen. Could it be that their socks are too tight?
Yeah, I think so. Technically, you should only wear a pair of sock, right? But with the older adults, their circulation is so poor. So try to just wear one and then keep moving. Just move your feet so that your blood circulation will just move. So I know it's hard, especially when they're in bed. Like in the hospital, we use those socks, the different colors. So because they're loose. But
Right.
if your socks are really tight, you will have that problem. Yeah, like just because you're not getting enough circulation on your feet, especially when you're just not mobilizing.
So
When
I
you
wonder
just
if there's another question here, and I wonder if it has to do a little bit with circulation as well. This the person is saying the soles of my feet get uncomfortably hot during sleep. I have to kick off my covers. Is there anything that might cause that? Just get you someone's feet heating up in the night?
usually they're cold. I never really heard of warm. Is
Yeah,
this a lady? Because sometimes with the menopause or
it's
whatever,
not. No,
it's just in
no.
general.
Yeah.
I haven't really heard, but that's still circulation. And also, it depends if you're diabetic, right? When you're diabetic, poor circulation, the nerve ending are not really, it doesn't really move proper your blood circulation.
Right.
Yeah.
Yeah. So it could be circulation. Yeah.
Yes,
Uh,
yes.
and
So I do recommend that they can just move for a little while, or just move their feet. Just even like this kind of just around, and just move your feet.
get some blood
Hopefully that will help.
circulating in there.
Yeah.
Yeah. Got it.
And sometimes I even ask them to press their toes, like the end, because this is a good exercise, right? Just to get the nerve ending, keep just the circulation problem.
Okay. Yeah. So just movement, getting some movement. Great.
Yeah.
So here's a question about, can you please tell us about Achilles heel and Morton's neuroma?
Okay. Morton's neuroma, it's where you're like when I had my bunionectomy. So my foot went really close to each other, and it's so painful. So it was pressing the nerve in between, like on your feet here. I got a treatment. My orthopedic surgeon just gave me a good shot of steroids in there, and it was so painful. I was not ready, and he didn't even put any numbing cream. It's just like a big shot in between. It's like, oh, that was so painful. So uh, he told me like, okay, we can release that pressure, but I don't really want to go back to operating room, right? So, and then he did recommend some of the cream. So then then the pain, it's going to be less.
Right.
Yeah. And same thing with your Achilles tendon. It's because of the nerve or, like also circulation. So for the other, just keep moving. Just do your, exercise and just keep moving your feet.
So, are there foot issues that will sort of impact the Achilles as well? If you have foot issues, will that create issues for your Achilles sometimes?
Yes. Well, obesity is number one, right?
Mm-hmm.
So if you're too heavy and it's so hard on your legs, so it does create a lot of pressure on your feet.
Yeah, yeah, and you don't want to have Achilles problems because that's
No,
painful.
no.
Right.
That's
Let's
what
go.
proper shoes is so recommended,
Yeah.
because you can also collapse your heels. Like if you have a high arch, you need that support.
Right,
Yeah.
and that's so it's not so you haven't talked about insoles. Is insoles something that more people should use than actually use them, like some sort of an insole?
As we age, the tissue, the padding that on our feet, it's getting less. It's like the elasticity of your skin. So it goes down like on your feet, on your shoes, right? So if you have like bunions and corn, I do recommend to see a special store for orthotics. I have also orthotics. I have like five different orthotics, and it also changed. Like they're so expensive, but you can also ask your foot, the podiatrist to pat it or check them at least every 2 years, because on the insurance, they cost about $500. So
Mm-hmm.
they're really pricey.
Yeah.
Yeah.
Yeah. Interesting. There's a question about podiatrists, and one of the folks is saying that it can be quite expensive to see a podiatrist, and some charge a lot more than others. And I guess they're asking, does paying more mean I get more from a podiatrist, or should I find it, or is it, are most podiatrists trained at about the same level?
Well, if I'm a registered nurse, so if I can't handle the feet or it's beyond my scope, I have two doctors that I send my clients. I even gonna make phone calls. Now you don't need a referral to see a podiatrist, so I can just phone the two doctors, one in Vancouver and one in New Westminster, and they can get in right away. But of course, it is expensive to see them,
It is,
like
yeah.
because they're doctors, right? So yeah, if it's just a straightforward basic foot care, I can look after that. But with diabetic, I see a lot of ingrown, and you can get amputation if it's wrong. I like to do ingrowns, but if it's not, I think that they need to see a foot doctor. I do send them to get a resection of that ingrown nails.
Right. So you need to see it, but and I think that that's a little bit of it's really hard to suggest to say that if a doctor. I think I can answer this one just from a medical point of view. Simply because a doctor charges more or less doesn't make them a better doctor. They have a choice as to what So you need to find one that you believe that has that you have a good recommendation from, and that you feel comfortable and trust, and that's definitely the doctor you'd like to see.
Yeah.
So.
Yeah, and the two doctors that I recommend, when I see the patient come back, or I'll see them again, it's like, oh, the bedside manners are nice, so which is nice, right? So one is in US, Mr. Dr. Catherine Can, and then the other one is in Vancouver. Yeah.
Great. And then I guess just I think we've answered most of the questions from the folks. I mean, although if people have more questions, please type them in the chat now. But I guess that on the last question is, how often should people be getting their feet looked at? How often should particularly as we age and we get into our 60s, 70s, and 80s, what's a good regimen for getting our feet checked, or for getting our feet
4 to 5 weeks.
4 to 5 weeks.
4 to 5 weeks.
Yeah. So that's do you think that most people get their feet checked that often?
Not really.
No. Yeah.
But as foot care nurses, with our price, that is still cheaper to see a foot doctor. Of course, we're trained in a different way. But you know, if you really, I mean, your hair grows in a month. So same thing with your nails, right? They do grow every month. So I
Mhm.
do, yeah. Some of the nursing home that I go, it's every 4 to 5 weeks,
Every 4 to 5
and I
weeks.
can see the difference. You know, like just the nails are in good shape. There's not much to do, but you know, like it's. I do recommend 4 to 5 weeks treatments.
Yeah, great. And it's interesting, and that's, you know, I think that at a certain age we kind of do our own foot care, but by the time we get to a certain age, it gets harder to do. It gets harder to bend over. It gets harder to see all of those things. So then,
Yeah.
yeah, and it's easy to let things go quickly. That's for sure. There is one more question about how, is there a way to prevent? I think you've answered this around, you know, just around the types of shoes and socks. But is there a way to prevent arches from falling?
Well, one is you know, like the orthotics.
Hmm,
If
right.
you think that you have a high arch, definitely you need to get orthotics.
Yeah.
Because as you age, what I said, the padding on your feet, it's getting less, right? So, yeah,
Yeah.
yeah.
Great. Well,
And
that's
proper
great.
shoes, of course.
Yeah, well, proper shoes. Yeah, I think, my feeling, I guess, anecdotally, I would say it seems to me that people start to wear proper shoes after after things have started to deteriorate a little bit. It's sort of the
Yeah,
way we act to things.
yeah.
We
They said
don't.
like at least every 2 years you need to change your shoes.
Yeah, get new shoes. That's right,
Yes,
and get good shoes. Good
yes,
shoes are worth the investment in so many different ways.
absolutely.
Yeah.
Yeah, keep active.
Well, that's great, Evelyn. Thank you so much. Is there anything you'd like to add just before we leave?
Yeah, so I'm booking. We're quite busy at Prime Care Medical Clinic, and also started at Burnaby Neighborhood in North Side. So if they want any more information about fit, just they can book through me.
Great. And also through the BurnabyPCN.ca
Yes,
website, there's information there. So if you're looking for information there, and again, this will be recorded, and it has been recorded, so it's available on the BurnabyPCN.ca website. Manny, maybe you can throw that slide up so people know where to go on that. I want to thank Yvonne and Alex for translating. That's so wonderful to have them here to be able to in real time do translations, and I know that so many people appreciate that. And really great thanks to you, to Evelyn, again for this in particular, but also for the work that you do. It's so highly appreciated.
thank
So
you, Jeff. Yeah,
okay, thanks very much, everybody.
yeah,
Have a wonderful Friday
yeah,
afternoon and a good weekend.
yeah. You too. Bye bye.
Okay, take care. Bye.
Thank you.